I got an email from a dentist the other day about minimally preparing BruxZir crowns, and then this case happened to cross my desk, so I thought I would point it out to you. This is the doctor who has done that kind of minimal preparation for a BruxZir crown, and by minimal preparation, we're talking about 0.6 millimeters, so 0.6 of a millimeter. So basically, you can prep it like you would a cast gold crown, is what we're fond of saying. Although you can go thinner than that with cast gold, but 0.6 millimeters. And a lot of times, you know, what I kind of want to insist on is that rather than guessing at what 0.6 millimeters looks like, that we use that 0.6 millimeter depth cutter that you can see right there. And maybe if I put it above the black, we'll get a little more contrast on it. That's not much. You know, there's really not a lot of reduction there, and that's what 0.6 millimeters looks like. But you just can't guess that. You need to have a 0.6 millimeter depth cutter to know that's in fact how much you have reduced. So we'll get back to that in just a minute. I want to show you something that I have done. So we'll look at this particular case where the doctor has done some minimally prepared BruxZir crowns. And I'll grab those crowns, bring them over, and we will put those onto the model. And they look pretty decent considering that they are minimally prepared. Now, one thing you have to keep in mind with something like this where we've got 0.6 millimeters is that if in fact the occlusion needs to be adjusted on these crowns. So if your assistant, your well-meaning assistant, was polishing the temporaries to make them nice and smooth for the patient, and she accidentally took them out of occlusion a little bit, and the opposing teeth super erupt. If we mark these teeth and we have heavy occlusion here, we're going to have to adjust the opposing. If these crowns are fabricated at 0.6 millimeters, and since we scan all these models in, we can digitally actually measure the occlusal reduction. If it's at 0.6 millimeters, you're going to need to adjust the opposing. If you adjust here and bring these crowns down thinner than 0.6 millimeters, I'm pretty confident they're going to break. They may not break at cementation or in the next week or 2 or 2 months, but they might, or it could be 2 years. But this material does not do well thinner than 0.6 millimeters. The ideal reduction for BruxZir, I always shoot for 1 millimeter, unless I can't, if I've got, you know, limited occlusal clearance on a second molar, for example. I even like 1.5 millimeters. In fact, when you see our hammer test, where we take the hammer and pound the crown into the 2x4 and it doesn't break, that's at 1.5 millimeters. So even if you want to make BruxZir the same thickness as Emax and go to 1.5 millimeters, you're going to end up with something that's hammer strong. Not that you necessarily need that in the mouth. I get that's a little stronger than we need. No one experiences a hammer in their mouth very often. So you'll notice that there's a warning here, adjust opposing, marked in black. And so preemptively, the lab has gone in and marked a couple spots where they think that even though it's at 0.6 millimeters, they want something rounded off here. And I often tell patients we've got 2 sharp little points here that they notice across from these crowns, and to keep the crowns from cracking or having you inadvertently crack the crowns, they want me to go in and just round these off. So I'm going to round these off a little bit, which sounds a lot better than I'm going to go in and prep it. Now, interestingly, when I get this from the lab, I would say it's about 50-50 that when I cement these crowns and then check the occlusion, I don't see any marks necessarily here that need to be removed. So even though they've gone in and rounded some things off, sometimes I will put the crowns in first and check, especially with something as strong as BruxZir, which isn't going to break if cemented like this and you have the patient bite down. And then you can see exactly where the spots are. But even in cases where we don't have to do this, when you have these minimally prepared BruxZir crowns, you need to adjust the opposing if the bite's a little high. In fact, I wish, you know, we send everything back in these little tooth cases. This one doesn't have the little BruxZir card on the inside yet, but I would love to take these minimally prepared cases. So I'm going to say anything from 0.6 to a millimeter of reduction to say 0.8 of a millimeter, and take a big sticker that wraps all the way around this box twice, and it says minimal thickness BruxZir, adjust the opposing only. And to get it out of there, the assistant's going to have to take a scalpel, or you are going to have to cut it out. It's going to be a total pain in the butt to cut it out, but you're not going to be able to cut it out without noticing that it says only adjust the opposing. because these single unit BruxZir crowns do have the lowest remake rate due to fracture in our laboratory. And really the only time they break is when they've been adjusted by the doctor, when it's not clear enough that we don't want them adjusted. You know, it's conceivable that your assistant could grab these crowns and put them on the bracket table and nobody would ever see this necessarily, and you check the bite and go, oh, it's high, you need to adjust the crowns, and then they would become too thin. It's not like gold where you can take it to 2 or 3/10 of a millimeter and not have it break. It's the second best thing, but it's not as good as cast gold. So if you ever do get one of these boxes and my dream comes true and there's a sticker around it that's a total pain to cut through, you can blame me and I apologize for it, but I want to make sure that one of these does not break in your patient's mouth. So getting back to that 0.6 millimeter depth cutter, that tiny little depth cutter, I thought it'd be easier to kind of show maybe the difference between this and 1 millimeter on some extracted teeth. And so I actually prepared some extracted teeth. And I've been playing around with the idea of minimal prep crowns, like how little can we prep a BruxZir crown and get away with it. And I kind of hesitate because there's enough dentists who tend to under-reduce anyway that if we give them permission to under-reduce even more, I'm afraid of what's going to happen. But this was 0.6 millimeter depth cuts on the axial surfaces and the occlusal surface. And then I prepped it down till I couldn't see the depth cuts anymore. And that's pretty minimally reduced when you look at that. Hopefully it's not undercut. I mean, that's, of course, one of the issues here is that you leave it undercut as you, it might still be undercut, but good thing it wasn't on an actual patient. So with the 0.6 millimeter, there is the tendency to not be able to prep enough to get rid of the height of contour. But it's a pretty darn conservative preparation. And so one of the things we've really never talked about with BruxZir is its minimally invasive nature because you can prep this little. The one caveat being, if you need to adjust the occlusion, it's got to be on the opposing teeth. And then here's using the 1 millimeter depth cutter. So you can see we've got obviously a little bigger chamfer as we go around there. A little more occlusal reduction as well, a little more axial reduction. That one does not appear to be undercut. When you go that deep, it gets past the height of contour pretty easy. So that's 1 millimeter. That's the kind of the ideal that we talk about for BruxZir. Again, if you really want it to be as strong as the hammer and the 2x4, you go to 1.5 millimeter. But that's overkill, you know, to be honest, for the human mouth. But if it gives you peace of mind, certainly, and I still do some at 1.5 millimeter when I see somebody who's got a lot of wear or somebody who's broke old PFMs in their mouth or their cuspids are just worn down flat. You know, if I can, I'm going to go to 1.5 millimeter. So on the right, here's the 1 millimeter, and then here's the 0.6 millimeter. It looks like I went over a little bit on that lingual margin. But you can see the difference. The 0.6 is definitely more conservative. There's definitely more tooth structure left, definitely more chance of an undercut as well. In fact, if you had a tooth where you had limited occlusal reduction, like on a lower second molar, wouldn't be a bad idea to do the 0.6 millimeter depth cuts on the occlusal, you know, where you were really being pushed, and then do the 1 millimeter depth cuts around the axial, so you can get a little more strength in that area. But really, when it comes down to fracturing, it's going to be that occlusal surface that kind of makes or breaks whether or not that crown's going to last or not. So since the dentist had written in, I wanted to get the chance to kind of explain that to you. And we are actually just about to start showing you some of the digital information in the cases. So this is just kind of a mock-up of how we want to do this. And you'll see the little red spots here. And this is for a crown on tooth number 3. And there's a note from us to the doctor telling them that to require the 0.6 millimeter of material thickness, which is the minimum for BruxZir, we had to adjust 0.26 millimeters to opposing tooth number 30. And so essentially what we're saying is that we had 0.4 of a millimeter of reduction, or almost 0.3, and now we need to go to the opposing tooth to make it the minimal thickness. And we're going to show the doctor where exactly it is. And what's probably a little more helpful too is to show them from the digital scan and be able to show it in cross section. Obviously it's blown up a lot. That looks like more than 0.26 millimeters. But this is the cross section of where this spot is. And so the dentist can kind of see, oh, okay, if I come in with a tapered burr and come in and kind of replicate, go a little bit shallower than what the occlusal, the slope of the occlusal surface is here, and I go a little shallower and come across there and just zap that off of there. That should be enough. So hopefully we'll be able to use this digital information to give you a little better idea of exactly where to go in and adjust it. Although honestly, I feel like most doctors, when they see it marked on the model like this, go, oh, okay, that's where I need to adjust. But maybe with the digital scan and the cross section, it'll give you a little better idea of exactly how much was reduced. So again, wonderful feature of BruxZir, being able to use it in a minimally reduced form. We just need to make sure that it's at least 0.6. And I know of no better way to make sure of that than to use something like a 0.6 millimeter depth cutter.